Hi, good morning, good afternoon, and welcome to our ASAP webinar series. This is a repeat webinar on PEPFAR expenditure reporting, which is a very important topic, I'm sure, as you all know, and you'll be hearing from Erin Dunlap from USAID, who's going to tell you everything you need to know about expenditure reporting. So we will turn it over to Erin shortly. I'm Callie Rolfswang from USAID Washington. I help support the ASAP program in Washington, and just wanted to share with you a few USAID announcements, and then I will turn it over to Mary from the ASAP team, who's coordinating our webinar series. Okay, so that's what I just said. Okay, so first is, SCAC continues to release weekly COVID guidance. So we encourage you to check the SCAC website for updates on COVID and PEPFAR programming guidance. The latest update in September 17th was on children's mental health and food security programs. So we encourage you to check that website. And then secondly, quite importantly, next week is our second annual local partner meeting. Of course, it'll be virtually held. ASAP is helping us host that meeting. And we have three objectives. First is to really ensure technical and operational excellence in COP. Through providing a platform for our partners to share their best practices and lessons learned. Secondly, we want to hear more from our partners on how we can improve our work, especially with local partners. And third, we hope to provide a space for you to connect with each other and start to create communities of practice and learning between local partners. So I hope you plan to attend. We have many great panels. Here's a quick kind of high-level overview of our meeting. It's really half a day. It's morning for Washington folks, afternoon for Africa folks, evening for Asia. The first day will be focused on operational and technical excellence, both Tuesday and Wednesday. Thursday will be an opportunity for some dialogue and feedback to USAID. And then Friday, which is local partners only, no USAID staff, is really about networking and creating communities of practice. So please follow this link to register if you haven't already, and you will receive an email from events at FPD, and you will have a username and login to get into our online site for the conference. Okay, I'm going to turn it over to Mary, and then we'll get to Erin. Thanks so much.
Thank you, Kelly.
All right, I'll stop sharing. Okay.
Okay. Hi, everyone. My name is Mary Goge. I will be walking you through the logistical part of this webinar. I welcome you to this webinar. Thank you for making time for our webinar today. During the webinar, we will have certain segments within which you can ask your questions. We will pause and take your questions. I encourage you to write your questions in the Q&A segment of the webinar. There is a platform that you can use, the Q&A platform, to type your questions for us. Once you type your questions, when we get to the Q&A segment of the presentation, we will read out your questions and answer them. After the webinar, we will also look at all the questions that have come in and send together with the PowerPoint materials and recording. We'll send that out after the webinar with the Q&A also and answers. 30 minutes before the end of the webinar, we will have a poll. We kindly ask you to take a few minutes to complete the poll for us. All webinar presentations for today, the presentations for webinar today, the recording and Q&A resources, as I mentioned, will be available on IntraHealth's website, but we'll also send them out on email to everyone. Thank you very much once again. I'm going to hand it over to Erin Dunlop to walk us through PEPFAR reporting webinar. Thank you.
Great. Hello, everyone. Thank you for joining. Bear with me one moment while I share my screen for the presentation. Great. And can someone confirm that you can see my screen?
Yes, we can, Erin.
Great. Thank you so much. Appreciate everyone for joining today. It is the last day of the US government fiscal year, so the real work begins. Unfortunately, it's been a very busy year. So that's why we're having expenditure reporting repeated again with ASAP, just because all of the Q4 reporting is now starting, as today is the last day of the fiscal year for the US government. Today, we will talk about a couple of different things. I'm going to give a little bit of a background about the PEPFAR financial framework, just because I want everyone to sort of understand kind of the language we're talking about with expenditure reporting. We'll go through, after we go through a background, we'll go into a little bit more of the process side of things. So technically, starting tomorrow, everything is an open period for data reporting. So I just want to be sure that everyone understands all of the process updates and has the opportunity to ask any questions. And then we will have some helpful resources at the end too. And then we'll take questions along the way. So as Mary said, please put your questions in the chat. We'll take regular breaks and then we'll take your questions and then we'll have time at the end as well. So really quickly, just want to give a little bit of a background on why we do expenditure reporting. This is an important part of PEPFAR to ensure that considering we're using US government taxpayer dollars, that we are being good stewards of those dollars, and that we have data for decision making available to really help inform us to ensure that we are using data to inform decision making. And we're spending our money in the right ways, on the right things, in the right places. And so kind of thinking more broadly about the PEPFAR financial framework, what does this really mean? So you can see in the rows that I have here is essentially a description of how expenditure reporting has been phased into a large part of the data that we have within PEPFAR. And that essentially means that we are tracking our expenditures by a program area and a beneficiary and a cost category. And we'll talk about that here in a minute. That's something that we really phased in fiscal year 18. Some of you may have done expenditure reporting before, and so this is not new. You've done this year after year after year. The big change that has really happened is that we are now budgeting in the same way in which you are all reporting your expenditures. So there's this alignment between how the US government sets their budget, which was the first time done in fiscal year 20. And then we are then asking partners to report their expenditures against that budget. That was a budget in the PEPFAR financial framework to really understand our investments. And so to really kind of ensure that everyone is clear in sort of the vernacular that I'm using is, so we're talking essentially about COP19 fiscal year 20, and COP stands for Country Operational Plan. That's essentially our strategic plan for what we're going to do in the country of Burundi in the next year. At a country level, what is going to happen strategically in order for us to get one step closer to epidemic control? That's our COP. And then we have a year tied to that. So you'll see in that first column, we're talking about COP19 fiscal year 20. which was approved last year. That next column, you can see the implementation dates. So COP19 fiscal year 20 means that we are talking about activities between October 1st, 2019 up until today, September 30, 2020. That is the implementation year for COP19 fiscal year 20. And so in that last column, you can see then the reporting dates. And so that essentially means that we're talking about you as the implementing partner, you've completed that implementation year. And so now you need to do your reporting. And that happens between October 1st, 2020 to December 18th, 2020. That's what we're talking about today, is what's going to happen in the next couple of months. So you can see an example at the bottom. I briefly mentioned this on the previous slide, but what we're talking about is really this budget versus expenditure exercise, which is a change this year. So you can see in that first graphic on the left, this is an example of the US government's budget tool. It's called the FAST. And this is an example of a budget that USAID set for a particular project or an implementing mechanism. And you can see that we have a program area, a beneficiary, and we have associated budget in each of those columns. That's essentially a snapshot of how the US government does budgeting. And then that green and gray box on the right in the second visual represents an extraction. It's essentially, you know, what we pull out every single budget from our FAST tool, and we make that available to implementing partners so that you all know your budget by intervention for each fiscal year. And so this is, for some of you that have done expenditure reporting, this might be a little bit of a change for you this year. I showed on the first slide that this was the first year that USAID, the US government more broadly, set budgets by interventions. And so and we're essentially kind of going into a new way of looking at our expenditure data. And so this is a sample of an implementing mechanism that has, in the first row, we're looking at a budget for program management. The next two rows are budgets for care and treatment aimed at young women. And then the fourth row is budget associated with community-based testing, again, aimed at women. And so this is really telling us a story. For many of you on the call today that may be more financially, more like financial managers, this is an atypical way of looking at a budget, right? Your accounting systems are not set up to track your expenditures by what you're spending on young women and adolescent females, or your accounting systems are not set up to track your spending by community-based testing. And so we understand that that is a different way of how you are tracking your expenditures. But what this tells us as decision makers is really what is this project doing? We can see that this is a project that is very focused on targeting young women and adolescent females, and it primarily does care and treatment community-based testing work. And so that's just a different way for us to understand when we're looking at a country level, what every project or what every implementing mechanism is doing. So it's what are we investing in, who are we investing in? That's one part of the PEPFAR financial framework. The next part, you can see I've highlighted two columns here. The first is that COP19 fiscal year 20 budget by intervention. So again, this was set, this is an example, but this was set last year. And so this is an example of what USAID did. And then that next column is an example of how an implementing partner might have reported the expenditures according to the budget. And so what we're seeing in the last column is the difference. What we as decision makers can see is you were budgeted at $532,000 for program management, but the partner spent $579,000 on program management for a difference of about $47,000. And then we can go down the rows and see for care and treatment for young women and adolescents, this implementing partner spent $7,000 more than their budget for that row. For the third row, they hit it right on the mark. They spent $80,000, which is what they were budgeted. And because of the overspending in the first two categories, we can see that there was some underspending by about $54,000 in the community-based testing aimed at young women and adolescent females. So this is the second part of understanding the PEPFAR financial framework is are we implementing according to how we budget? And I want to just make it clear right from the very beginning that there is an understanding that you're not always going to spend your money and you will not always implement according to how you are budgeted. There is an understanding that there is going to be, so there needs to be flexibility, and that you're not going to see a zero difference in every single row in that column. We understand that, especially a year like this year with COVID that has really impacted implementation. However, it is still something that I think when we are trying to understand these misalignments, if we are overspending on treatment, but we're underspending on testing, how is that impacting our targets? Did we also underachieve in our testing targets? We didn't spend all the money. Did we meet our targets or did we not meet our targets? And so these are just some of the questions that USAID is being asked by OGAC, as well as USAID is looking at this data in this way as well. Is just trying to understand how are we spending according to how we're budgeting? And if we're not, where are those variations occurring and why are they occurring? Again, we're saying we're completely understanding why there are discrepancies, but we do want to better understand that. So in talking about the fiscal year 20 COP19 budget, essentially how is that built? And so you can see on the bottom that I mentioned USAID last year when we did our COP19 planning to start October 1st of last year. USAID set budgets by program area and beneficiary. That was discussed with in the interagency. It was approved by SGAC, and it should have been provided by your USAID ACOR. What you are going to be doing is then reporting against your COP19 fiscal year 20 budget by cost category. That is essentially the responsibility of the implementing partner during the expenditure reporting process. And when I say cost category, that essentially means what are we buying, right? Okay, I'm going to take a break for questions in just a few minutes. I just want to go through a quick refresher of essentially what the framework looks like, and then we'll take a questions in about 5 minutes. So when we're talking about program area, what does that mean? So this is a sample of the expenditure template that all of you will complete for Q4 reporting. And so what we're talking about right now is a sort of an overview of that top row, which is the program area. And that essentially is the broadest general term for what are we doing? What is this project doing? There are 4 site level program areas. So that's prevention, testing, care and treatment, and socioeconomic, which is what we refer to our OVs, our Orphans and Vulnerable Children program. We refer to that as socioeconomic. We have 1 above site level program area, and then we have 1 program area called program management. For those that are maybe a little unfamiliar with the terminology of site versus above site, site level activities are those that occur at the point of service, or if you can track activities to a specific site, like a specific laboratory, or a specific pharmacy, or a specific clinic. Those are all site level. You can say we pay salaries of someone at this place. It's this location is directly benefiting from these dollars. When we are talking about above site, those are activities that tend to be more benefiting of the country itself. So we're talking about health system strengthening, policy work. That's something that you don't necessarily tie to just one facility. You can tie it to all facilities are benefiting from that work. Surveillance activities, a lot of pre-service training, things like that. Those are all considered above site. And then the last overview that I'll give, and we'll talk about this here in just 1 second, is every program area needs to state whether the activities are related to service delivery or non-service delivery. So when we say service delivery, that means they're activities that have direct impact with the beneficiaries. So that's running your clinical program. That's paying salaries for workers that are going to be doing counseling. You're directly interacting with the beneficiaries. Non-service delivery activities, you're essentially not, it's money being spent that is not directly impacting beneficiaries, but money is still being spent at the site level. So this is what we typically see with technical assistance, supportive supervision, training of staff. You are essentially improving quality at a particular facility, and you're not exactly directly working with the folks that are benefiting from those services, but you're impacting the services. And so that's considered non-service delivery. I'm going to go through these slides very quickly because I just want them to be illustrative, but this gives you an example of what I just presented. So we have a program area called care and treatment, and you can see under care and treatment, we have what we call sub-program areas. So there's clinical services, there's lab services, HIV drugs, and something called non-disaggregated. And then you can see what we just talked about. Every one of the sub-program areas must be, it must be either service delivery or non-service delivery. So again, we're still talking about care, we're still talking about program areas. You can see there's many types of program areas here. Again, I'm not going to go through these in detail because we do have great documentation and resources to help give you all the definitions and explanations of what these are. One just quick note on program management, because I know we get a lot of questions on this. This is essentially where you as the implementing partner will be reporting your management and overhead costs, your indirect costs, and any closeout costs that you have. Okay, the next part of an intervention that we're building is the beneficiary. That's the second row of the template. And you can see we have 4 targeted beneficiary groups listed here, and we have 3 demographic beneficiary groups. And then we have that number 1 group called non-targeted population. And we would use that non-targeted population. You'll see this a lot in budgets and expenditures. And it essentially means that you're not targeting one specific beneficiary for the activities that's included in those expenditures. You might have multiple beneficiary groups selected in that row of budget or expenditure. So you might have an adult woman and pregnant and breastfeeding women. Those are 2 beneficiary groups. But you don't want to just pick one, and so you might use non-targeted, non-disaggregated. Again, I'm not going to go through all of these, but you can see similar to the program area, we have where we had sub-program areas, we have for beneficiaries, we also have sub-beneficiaries. And so you can see some of the information here as well. Again, there's documentation on this that you can look at outside of this presentation to get more of an understanding of what the definitions of all of that are. And so what we just talked about, the program area and the beneficiary groups, when we combine those 2, it is called an intervention. And so you can see what we've done here is we've combined a number of different interventions, and going down the column, example number 1, we have community-based testing, which is service delivery in nature, aimed at the sex worker key populations. Or the next intervention, you have, again, socioeconomic is our OBC program. The sub-program areas, education assistance, service delivery aimed at the OBCs themselves. So these are examples of interventions. And so that's essentially what you're reporting in your expenditure reporting template. And then if you want, again, definitions, and inclusion, exclusion criteria of all of this information that I just very, very quickly sped through, please go to the PEPFAR Financial Classification Reference Guide on datum.zendesk.com. So those first 2 parts are the intervention. And then the last part, this third part, is going to be the cost category. And again, this is where you as the implementing partners will really be filling in the details on what did you buy according to each one of those interventions. And so you can see again a sample in the expenditure template. On the left, you can see there's a number of different sub cost categories, and things like personnel, travel, subrecipient, indirects. These are things that should already be familiar to you because you're reporting this to us. You're reporting only this to us in your SF 425, But you can see we're getting more information about what you're doing as an implementing partner when we add in the program area and beneficiary part of this. Okay, I'll stop there and see if there are any questions that I can answer. Just want to note we are going to shift in the next part of this presentation more into the process part of things. So if you have questions on how do I report this year, where do I go, where do I find the template, things like that, we're going to discuss that here in the second half of the presentation. So anything on anything with the framework that I can answer.
First question is, could you clarify how PEPFAR makes linkages and comparisons between programmatic results and financial expenditures, and if you have tools for implementing partners to do this more effectively?
Yeah, I mean, I think we'll distribute the slides so you can see, but I think this is the first year that we will be looking at how budgets were expended. We will be sure that if you do not already have your COP19 fiscal year 20 budget by intervention, that you will have it at the time of reporting. But it is really insightful when I think as at PEPFAR, if we are spending months and months and months discussing a COP and approving a COP and everyone's in agreement on targets and budgets, but then we find out that maybe an implementing partner did not have enough budget, or the partner spent way more money on testing than we really needed them to or wanted them to. Why are we spending all of this time on setting budgets if they're not based in reality, or if they're not being executed the way that we need them to be executed? Of course, results will not be met if the budgets are not expended in the way in which they need to be expended to be successful. And so this is the first year that we're doing this, and so and this is how it will be moving forward. So I do think it's going to be insightful to do that one sort of comparison of when you think about, I gave that example of the table where we overspent on care and treatment. What did the results look like? Did you meet your results? If you overexpended your care and treatment budget, but you still did not meet your TX new targets, I think that's a question as to what happened. And then, on the flip side, if you think about maybe you underspent on your testing, if you met your testing targets, maybe we didn't need to fund as much money as we did for testing. Maybe more should have gone to care and treatment. So things like that, I think, is how we really tie looking at expenditures to results. But just other things that we look at is just what expenditures and results look like over time. We look at trends. We bring in different points of data. And last thing I'll kind of say about this is that expenditure data, and for those who, expenditure data, it's extremely contextual, and there's a lot of explanation that goes into it. It is not perfect data, but it is one piece of decision making. It's not like a black and white story where we say, well, if this is what your data looks like, then this is what we need to do moving forward. It's a part of the conversation. It doesn't mean that there's a lot of good reasons why you may not have achieved your targets. I could list 5 reasons why. I know many partners are unable to meet their targets. It may be related to spending. It may not be related to spending. It's just a part of the questions that we at USAID and your mission colleagues are being asked as to what is really going on. And so I think as implementing partners, it's really helpful for you to look at your data in this way as well, so that all of us are on the same page regarding expectations, and you also understand how we are looking at that data as well. But again, I mean, just understand it's only one part of the conversation. It's not the be all end all, but it's why data quality is very important. And it's why taking this, really prioritizing this is important, because we look at this data. SCAC looks at this data, mission colleagues look at this data. It needs to be correct, as correct as possible. So, just want to make a plug for data quality there, that it is data used for decision making. A lot of other factors come into play, but just give this a lot of time in the next few weeks. Try to prioritize it and get it right. so that when you're reporting your expenditures, it appropriately reflects your program and the good work that you've done in the last fiscal year.
Thank you. Our next question, in the example that you took, is program expenditures the section that one would use to record recurrent expenditures that support functioning?
Sorry, I'm not getting the question.
In the example that you took, the segment for program expenditures, would that be the same place to record recurring expenditures that support functioning?
Yeah, I think, sorry, let me see if I can read the question. It might make it a little bit easier for me.
It's in the chat. It's in the chat section.
Yeah, there's a couple of questions here. Yeah, so I mean, essentially all, if you're talking about investment versus recurrent expenditures, this captures all, both investment and recurrent. So this should be an exhaustive report of everything that you have spent in the last fiscal year, regardless of whether it was in startup or whether it was in you know, a more mature year in the project. Sorry, I can try to answer it another way and find the question, but I'm not sure I answered that.
All right, thank you. Is there any acceptable or flexibility rates between actual expenditure against approved budget on expenditure reporting?
That's a great question. Again, we're doing this for the first time this year. The answer is no. We do not have any guardrails or any kind of, you know, points of measurement for that right now. What I think is most important is that you know, many of you might have gone through the COP20 budget work plan process, and you might this might be resonating with some of you where you know, you saw budgets that didn't seem to reflect what you thought was more appropriate for your program, and there might have been a discussion with USAID about that. And that's essentially what we're trying to do, is we're trying to understand if we are not budgeting, we're trying, I think, to reconcile the process of budgeting and expenditures. And it's something that's a moving target at this time. So, you know, I think everyone's learning, but budgeting happens. You know, budgeting for this fiscal year happened a year ago, and it was a pretty internal process within the US government. Also, please understand that, you know, there is one resource envelope for the country that all implementing partners must essentially fit under. So it's not just partners for USAID. We have other implementing US government agencies such as CDC or DoD that there's, you know, only so much money that we are given from OGAC and only so much money available. And so I think we do our best to do an interagency budget process, but I think what we want to know is what actually happened. We will work with you on trying to understand these misalignments. And like I said, the misalignments are completely understandable. Even in a non-COVID year, I think misalignments are understandable. I don't have an amount for you as far as 10% or 20% difference. I just want to reemphasize, please report according to how you actually spent your money. And the last thing I'll say about this too is that expenditure reporting is not an audit. It is not your legal SF 425 that you submit every year as part of the contract. ER is a contractual requirement, but this is an exercise in data. We understand that it is an estimate. We hope it is a best estimate, but this is not an audit. This is not, you know, when we see these misalignments, it's purely from a data consumption point of view.
Thank you. Our next question, if implementing partners self-report in their expenditure reports, why wouldn't they simply enter budget figures that mirror their fast allocation? What's the incentive not to do that?
I think what I just mentioned is, if your budget is not what you need as a partner, we need to see that in the data. I do not want partners to feel as if you need to just be reporting against you just need to essentially just put in your ER report whatever your budget was. If that's what you choose to do as an organization, that's your decision. But at the end of the day, I think, as I mentioned, we do a number of different triangulations with data. And I think everything eventually, I think if you really are underspending and you're saying that you're not, it might come out when we look at the target achievement and things like that. And so we want to be sure we get it right. And so we'll work with the misalignments. That is not a problem. I think what we're trying to reconcile right now is those budget amounts that are not sufficient. And again, I think anyone that went through COP20 budget, you might have had this discussion with your ACOR. I think SCAC understands that we need to do better at budgeting and have it be more accurate, given that this is extreme detail that we're talking about, right? I mean, this is a lot to really hit right on the head. Yeah, I'll stop there. I mean, it's a lot. I mean, when you think about as an implementing partner, you completed your COP20 work plan budget template, and that's the expectation. At the very least, what the expectation is. And if that's going to change, let's talk about it. We can work with that. But I think we just want to at least have some kind of a ballpark. And then if we're not hitting that ballpark, let's talk about it.
Thank you. How can we report and distribute common costs to respective programs?
So I think if this is saying that if you have expenditures that are going across multiple program areas, so if you have someone that, if you're paying salaries for healthcare workers that goes across care and treatment and testing and prevention, how do I divide that up? I think that we're not as prescriptive in the allocation methodology. I think technically you are allowed to put the spend where the majority lies. So let's say you have a line item that is healthcare worker salaries, and the majority of time that those healthcare workers spend is on care and treatment clinical services. I mean, you technically could just put the entire, even though they work on testing and they work on prevention, you technically could put it all in just care and treatment, because that's where the majority of the spend is. I think if you can tease it out and you can come up with a basic allocation, such as, we know that this bucket or this grouping is 50% care and treatment and 30% testing and 10% or 20% of prevention. Just make those percent allocations and then divide it up there. Again, you will have, moving forward, a budget by intervention. Starting with COP20, you will have that level of granularity. You will know exactly what your healthcare worker salary budget is for each program area. We don't have it for this year, but you will have it for COP20, those of you that went through that process. But I would just say, try to make this as accurate to what your program actually does. I mean, we give you 6 weeks because we think it takes 6 weeks. But ultimately, we leave it up to every organization to make that decision.
Thank you. Can you elaborate the impact of COVID on expenditure reporting irregularities, and what considerations are there from PEPFAR end for potential underspending and not meeting optimal targets?
Right, that's a big question. I can't answer all parts of that question other than, of course, this is an extreme challenge to everyone involved, whether you're an implementer or a beneficiary. And I think that there certainly are impacts, and we are documenting those impacts at USAID, and we are working with SCAC on ensuring that open line of communication on how this has impacted our work. As far as will you see anything in the guidance or in the template about COVID, you will not. And so I think that's just something maybe to note in your reporting. I do actually think there's a section in the template for comments, but I think we are expecting things like, there probably will be more in the supplies category than what we've seen in years past. You bought money, if you spent your money on PPE, we probably are going to see more money in the supplies cost category or in the travel cost category if you went out and you delivered drugs to folks rather than having them come to the facility. So we do expect, we expect, but then we also expect in some cases that activities had to completely pause. And so maybe there's underspending in that area. So, I would say work with your USAID ACOR and ask if they want to have any further documentation on COVID. But as far as, is there going to be, a section of reporting for COVID? No, it will just be included in your normal reporting, unless you have a separate sort of description of where those impacts are. But that's sort of on a country by country basis.
Okay, we'll take our last question for at least this question segment. There are actually two questions that are somewhat related. One is asking what's the due date to submit PEPFAR report, and the other question is today is September 30th, 2020, and the presentation on the report deadline is on the report deadline day. How do we reconcile this?
Okay, so the first question, we will get into process in just a few minutes. We're moving away from background and now we're focusing more on process. And the second question kind of relates to that. I mean, the fiscal year has not ended yet. So you are, potentially still spending money, or you're potentially still money is going out of your bank account today. So we can't start reporting for expenditure reporting until the full fiscal year has closed. And so what will happen in the next 3 months is the reporting period of what happened in the last fiscal year. So you have basically 3 months to submit a financial report, an expenditure report on the last year of implementation. So it's looking backwards. Okay, I'm going to move ahead. We will have, these sections will be smaller, or they'll be shorter. So it won't be as long as that first section. We'll continue to take questions. Again, I want to start focusing now on the process part of this. And so we'll start with all of the different stakeholders that are involved in PEPFAR expenditure reporting. The first group of stakeholders are going to be ER backstops. I am an example of an ER backstop. I am a USAID staff member that sits at headquarters, and I basically am assisting the USAID mission team on the planning and the rollout of expenditure reporting for Q4 for the last fiscal year. So I'm sending regular updates to the mission teams. I'm collecting frequently asked questions. And then if there's any technical questions that you as the implementing partner have that maybe nobody else can answer, that question would come to me as one of the ER backstops. I'm part of a team of about 7 or 8 people. And so there's 7 or 8 of us at headquarters that are the ER backstops. Your main point of contact will still be at the USAID mission level, but there are those of us here at headquarters that are supporting from a high level, as well as kind of liaising with OGAC and the rest of the Office of HIV/AIDS here at headquarters. The next group of stakeholders are the ER points of contact, and these are essentially USAID mission staff who are designated as sort of the leaders of all things related to ER at the country level. So it tends to be a financial person as well as usually like an SI person, and they essentially are coordinating with their office at the mission, coordinating with all the USAID ACORs, and likely coordinating with you as well. In order to determine what partners need to report, what are the due dates, does everyone have all the materials? I would say at a USAID level, next to your ACOR, this is your next point of contact that you will work with the most. So the USAID ACORs or activity managers, again, these are USAID staff members, mostly at the mission level, who are likely folks that you have already been in pretty close contact with, and they are ultimately responsible for the reporting that happens and working with you to ensure that you are meeting your contractual obligations with expenditure reporting, and that you are submitting a data report that is accurate, that is timely, and ultimately your ACOR will approve your expenditure reporting template. The USAID implementing partners, that's those of you on the call, and you are all essentially responsible for the successful completion of the ER template. This is in all of the contractual language and all of your awards. You essentially are required, and we are expecting that you will go through all of the resources, that you will ensure that you are accurately, as much as possible, completing an ER template, that you are being communicative, that you're being timely with this, and that you're successfully submitting a template on time. That is a requirement. ER is a requirement ultimately, and it's a deliverable of implementing partners. And then last, we have TA consultants. And so for anyone that may have gone through expenditure reporting before, you may be familiar with who these folks are. This is the last year that we will have these TA consultants, but they're essentially contracted through IntraHealth, and they are going to be your main points of contact on a day-to-day basis. There's one consultant assigned to each country. For almost all countries, there's an exception of a few countries that do not have consultants. I'll talk about that in just a second. But essentially, these folks are going to reach out to you and provide assistance to you as implementing partners to ensure that you have all the support, resources, questions answered in order to successfully complete this deliverable. The countries that don't have consultants are like Burma, Cambodia, Mali. I think that's it. I think everyone else should have a consultant. Some of you may have already been linked to your consultants already. Even if you do not have a consultant, essentially your ER backstop will provide that technical assistance. So it's not as if you will not have support. You just will not have a support from a consultant, but you will have that support from headquarters. But these are exceptional resources available to you. This is the last year that you will have a consultant working with you. We've been doing this for 7 years. Unfortunately, this project is ending, and so it is really felt by SGAC that their capacity is built, and that we need to sort of move in the direction of institutionalizing this in the way that we've institutionalized MER reporting and things like that. So this is a great resource available to you. They will be reaching out to you shortly if they have not already. Yeah, they're great resources. So this is, I'll take questions on stakeholders. Again, we are going to go into process next, so hold your questions on process, but if there's any questions on responsibilities of the different stakeholders that I've just gone through.
Okay.
No?
No, we don't.
Okay, excellent, thank you. Okay, so let's talk about then what your responsibilities are in the next few weeks. So we'll talk a little bit about the basics of expenditure reporting. This essentially means that there needs to be one ER template completed for one mechanism per OU. I mentioned an IM, or as an implementing mechanism, or like the project that you all work on. An OU is the operating unit. That just typically means the country. So it is one template per mechanism per country. So if you are working for an organization that has multiple projects and one in Uganda, you cannot submit just one template combining all of the expenditures for what you spent in Uganda. You need to submit one template for each distinct project that your organization is implementing in Uganda. So one template per mechanism per OU. And folks will let you know what you need to complete, so no worries on that. For those of you that are in regional programs, so if you are in the Asia regional program, the West Africa regional program, or the Western Hemisphere program, it's going to be the same as last year. It's the same regional groupings that I just mentioned. And again, it's one template per mechanism. So if you as an organization are implementing a project in Senegal as well as Mali, you're actually not going to submit one for each country. It will actually just be one for all the countries that you work on. That's only for regional programs, and you will know if you are in a regional program. Most of our work is not in the regional programs. But that is the one change, is that if you are in West Africa regional, Western Hemisphere, or in Asia, you do not need to disaggregate your reporting by country. It only just needs to be and that's why we call it an operating unit, is that the West Africa regional program is an operating unit. So we only need one IM per OU. So that's why you combine for only regional programs. Okay, so then what is the methodology for ER? So you will report using a cash basis of accounting. So that essentially means any funds that left your bank account as of today should be counted for ER. If you accrued any expenditures today and then you paid them out next month, that would be reporting that would go in next month. So it's a cash basis of accounting, only the dollars that left your bank account today, as for the whole year. You will only report on PEPFAR funding. So if you as an organization also receive USAID malaria money, you do not include that in what you spent for the last fiscal year in expenditure reporting. Similarly, if you received HIV money from the Gates Foundation or another organization, you do not include that. This is not just HIV reporting, and this is not just USAID reporting. This is only USAID PEPFAR reporting, USAID PEPFAR money. You must report your expenditures in US dollars. We do not have standard exchange rates, just whatever you use to convert your currency for your regular reporting. That is the rate, or that is the process or the methodology that you will use in your reporting, but it must be in US dollars. The prime partner is responsible for all expenditures. So if you are a prime partner and you have 3 subrecipients that you manage, it is your responsibility to coordinate the collection of expenditures by all of your subrecipients. So the subrecipient doesn't necessarily need to complete a template and submit it, but they do need to have all of their dollars captured. If you are submitting to USAID that you spent $1 million in the last fiscal year, and that's inclusive of your subrecipients, and you spent 750,000 as the prime and the sub spent 250,000, don't just submit a report of 750,000. You need to say what you actually spent, both prime and subrecipient combined, that full $1 million. And then again, you need to include everything from the last fiscal year. We talked about this earlier in the presentation. So that's what you spent from what left your bank account from October 1st, 2019 until September 30, 2020. That is the reporting year. All right, so additional things on what is new for this year. We'll have a couple slides on this. Nothing major this year for anyone that may have done ER last year. So there's a couple of updates to the cost category names. So for personnel and for contractual, there was just an update to call it clinical and ancillary for each of those categories, which is just a little bit more aligned to how we track and how we talk about our human resources for health. So that shouldn't impact your reporting, other than there's just a name change. There was an additional sub-program area added called Primary Prevention for HIV and Sexual Violence. It is new this year, so you probably will not see it referenced in the COP19 fiscal year 20 budget by intervention. But if you feel as if you do have spend in this area and you want to add it into your template, talk to your ACOR about including that. And they'll help sort out how you would report expenditures in that new sub-program area for prevention. And then the last change, which is a really positive change, and I really encourage folks to take a note of this, is that there is a new program management category called closeout costs. So if you are going into a closeout period now until the end of the year, you are still required, it is part of the closeout deliverables to submit an ER template. So before you close out a program, you must make sure that you submit an ER template. And even if you have a couple of months of implementation, it's important that you separate out what your closeout budget is, and that you select program management closeout costs in the template. So that just makes it easier for us to understand if we're looking at a partner's expenditure report and we see like $300,000 and we don't really know what went on. We typically think it's probably closeout costs, but we don't really know. But it's now we have this disaggregation, and it's a really great way to help us sort of track the regular program management and separate that from the closeout cost program management. You'll see I have this link down at the bottom of many slides, and essentially if you have questions about the inclusion criteria, the definitions of all of these program areas or cost categories, I encourage you to look at the PEPFAR Financial Classification Reference Guide, which is found on datum.zendesk.com. So an additional change to reporting this year for anyone that may be familiar with this is, or may have gone through the COP20 work plan reporting process, is there is a new, so you must submit you will complete an expenditure template. It's Excel based. We'll go through the template completion here in a minute. And then once you've completed your template, you need to upload it to an online system called Datum, and we'll go through that as well. And so anyone that may have reported in the past, you may remember that you would go into Datum and you would select the data entry app from a menu, and then you would do your submission there. That has changed. OGAC has updated the Datum system, and you will now report in an app called the ERB app. And this is where you will need to go in the menu when you're in Datum. Go to the menu and select ERB to do your template submission. I'm not going to talk about Datum very much today because I do not think that this is live just yet. I think everything goes live tomorrow. But you'll see again, I have that datum.zendesk.com link there at the bottom. There is a fantastic step-by-step guide on how to submit your template in Datum, where to find this app, where to go, and any challenges that you may have with upload and submission. Go to this link, please bookmark it. This is going to be, I guarantee 95% of the questions you have will be found in this document on how implementing partners can upload and submit their template. So please go to this link and download the submission file for IPs, and this will answer all of your questions. But just wanted to note this is a change. A little bit about deadlines. So you can see that the guidance has essentially already been released. Everything is published on datum.zendesk.com. You will not get any documentation sent to you by email. USAID does not control the documentation that is, and the supporting resource materials. OGAC does, and so they post all of their resources, including the template, the reference guides, the upload guides. They will post all of that to datum.zendesk.com. And so you need to go to that website, and I think as of now, everything is current and up to date. You can download your template today. You can download all the users guides today and start to get familiar with all of that. That's current. We also ask that in the next coming, basically in the month of October, start to either reactivate your Datum account, or if you are new to this process, to request a Datum account. Usually it's 1 or 2 people from each organization, just in case someone's sick or someone's out. Try to have more than 1 person that has a Datum account, so that when you are ready to submit, you already have your account ready to go. Don't wait until the last day for the Datum account registration and all of that. And so basically, as you can see, tomorrow, October 1st, is when everything basically opens in Datum. So you have from October 1st until on or around November 6th. November 6th is what we typically reserve as 1 week for final ACOR review. That November 6th deadline, it might be different in every country. Some countries will have different deadlines on when they want to review your template. So we put November 6th just because that's in the PEPFAR data calendar, but it's possible that your ACOR or someone else that you're working with may give you a different date of when they want to see the final draft of your template for their review. But as you can see, November 13th, this is a hard deadline. This is when the online system datum will close. If you have not submitted your template by November 13th, you have missed the deadline and you have missed having your data, all the work that you did in the last 6 weeks, it will not be captured in the data collection period. So essentially what we try to encourage is we see a huge uptick in the number of people that go into datum and try and report on November 13th. Do not wait until the last day. There will be technical issues, there will be questions. There is a help desk, but you know, again, the last week, there's a queue. So you want to be sure that you get this in as soon as possible so that if you forgot your password or if you don't have an account or if you have errors upon upload, that you give yourself a day or two to really resolve all of those. So from the period of November 13th until December 12th is essentially datum closes, and there's sort of a data packaging that happens. And then what we are able to see at USAID is a data set, and we can do some basic analytics on this data set and see if there's any errors in the reporting. So what that means is from December 1st until December 18th, that's our data cleaning window. And so you essentially have up until the 18th to redo your submission if you forgot some expenditures or if you put them in the wrong category, or if you missed the data entry window. You can then go use that data cleaning window to make your final changes. But the absolute final deadline will be December 18th. And there are no late submissions accepted. We do not control the system. It closes when it closes. The other thing I want to say is you cannot email your template to USAID. You can email it to them for a review, but there is no one at USAID that has the ability to submit a template other than you as the implementing partner. It is your responsibility to submit it, and only you have privileges in the system to submit a template. I do not have that privilege. Your USAID counterparts at the mission do not have that privilege in the system. We're not granted that privilege. So, you know, if you are running late, you cannot ask one of us to just upload it for you, and you cannot email it to us and have it count. If it's not counted, that essentially means we do not have that deliverable for you, and that makes it extremely difficult to try to understand what you did in the last fiscal year, how you spent your money, and triangulate that with other pieces of data. Okay, those were the deadlines. And so I mentioned this in the stakeholder section, but there is technical assistance available to all of you as implementing partners, as well as to your mission colleagues. I mentioned that there is one ER backstop assigned to every single country, and there is a country-based TA consultant via IntraHealth to help you as well, with the exception of those like 3 or 4 countries in which the ER backstop will work with you. Again, please take advantage of those consultants. Please be responsive, things like that. One thing I do want to note as well, for those of you that may be familiar with this in the past, you may have worked with a consultant in person. You may have had them come to your office and sit down and meet with you and look at your records and things like that. Essentially with COVID, we're in a period of time where there are some offices that folks have not gone back to the office and they're still working remotely. Some offices where some people are going back on certain days. And there are some offices where everyone has gone back to the office. On a global level, of all of our USAID implementing partners, it is essentially a combination of all those 3 scenarios that I just gave. And so I think as we are working with our consultants and to essentially keep everyone safe, given everything that's going on, all of the TA from your consultants will be virtual this year. Even if the consultant lives in the same city where your organization is based and your organization is back to 100%, we have instructed the consultants to only provide virtual support. I think that the majority of what they do is virtual anyways. I think our consultants are fantastic, and I think that this is something that they're still going to be able to give technical assistance to you in a way that is still very effective. But please do not ask your consultant to come meet with you in an office. They've been instructed not to, and that's to keep you safe and to keep them safe. So appreciate your flexibility on that. And if you have any concerns about your technical assistance, or if there's any challenges that you are facing due to connectivity or distance or things like that, don't hesitate to reach out to your USAID ACOR. You can reach out to me as well, and we'll work on a solution for you. But just appreciate your flexibility. Okay, I will stop there. We will go into the template after this. So if you have template related questions, that's the last section of my presentation, and I'll show you how to complete the template and how to, generally speaking, work in Datum. So if there's anything on methodology or process that I just mentioned, I'm happy to take questions on that.
Thank you. How can we charge our time to work on ER report after the project has ended?
I mean, I think that depends on if you are in a period of closeout and you are doing the closeout of the award, the implementation of the activities has closed, then your time would be allocated to program management closeout costs in the personnel section.
Thank you. How do we treat the expenditure incurred before 30th of September 2020 and have not been able to make actual cash payment to vendor by the 30th and will only pay in October?
Exactly. So if you've accrued those expenses, it will hit the books in October. That will be for your fiscal year 21 expenditure report. So if you spent if you accrued a whole lot of expenditures today, and it's not going to leave your bank account until next month, you're not going to pay all that off until next month. For the purposes of ER, you will report it in fiscal year 21. I understand it was accrued in fiscal year 20, but it was expended in fiscal year 21. So that's where it's a little bit different with the cash basis of accounting regarding the methodology. So I'm sure some of you, especially with sort of your finance and accounting hat on, are probably thinking, well, but that's not totally reflective of that sort of, what if that's going to sort of skew the funding a little bit? When you think about year to year to year, that same kind of cushion is going to happen. So it's the same thing from the last year. If you paid out, if you accrued a lot of expenditures in September 30th last year, and you paid it out in this year, it's probably going to be the same kind of margin of error as far as the amount of money that will leave your bank account in October and it will go into the next expenditure report. So we understand that's just a limitation of it, but that's the methodology that's preferred for ER.
Thank you. Is the data cleaning period close to December 18 or around the December 18 date?
So the data cleaning period closes on December 18th. I think it will be something like 3 p.m. Washington, D.C. time. And so, that is a hard deadline. So you will basically have, essentially, if you think about it at a broad level, you will have from tomorrow until December 18th to submit a final template in the system. Now, you should also submit your template by November 13th. That will be important that you hit that deadline for the initial data collection. But if there's any issues, like let's say you forgot, a couple $100,000 in your ER report, you will have that data cleaning window to make that change. But absolutely, after December 18th, we will not be able to accept your template. You have missed the window, you have missed the deliverable, and that will make it extremely difficult for us to talk about what you did regarding your expenditures. So please take that November 13th and that December 18th deadline seriously. And again, you cannot email any of us if you are running late. If I were you, I would mark the deadline as December 17th and November 12th. to give yourself a little bit of extra planning because there are no exceptions.
Thank you. We are a new partner, and so we did not input our budget as the project began this January. Are we still required to report in dating for that year?
Yes. So as I mentioned in my first slide, if you have spent any funds between October 1st, 2019 and September 30, 2020, you are required to report. If it's 12 months, if it's 6 months, if it's you just spent $12 2 days ago, you have to report those $12. Any spend that you made and left your bank account between that reporting period, you must report to ER.
Thank you. Is expenditure reporting under far different from one under other funding mechanisms, and are the cutoff dates for prime and sub-recipients the same?
Yes. So again, the prime is responsible for the one template that is submitted. So if I am the prime partner and I manage 3 sub-awards, I need to go contact each one of my 3 sub-partners and say, what did you spend last year? And it needs to be, let me see if I can find a template here. It needs to be according to the template. We'll go through this in a minute, the subrecipient reporting, but you need to know, what did each of my sub-partners spend on care and treatment, on prevention, on whatever. And so I, as the prime, need to ensure that I contact each 3 of them and I say, what did you spend in each of the interventions? You need to give that information to me. I will add it to what I, as the prime, spent. And then I submit my one template with them combined by November 13th, and again by December 18th.
How about for fixed award mechanisms?
It does not matter what the award type is. As long as you spent PEPFAR funds, regardless of the award type, you must submit an expenditure report.
Those were the only process-related questions we had so far.
Okay, excellent. All right, we'll go to the template, and then we're kind of nearing the end here, so thanks for bearing with me. So this is essentially a look at what is it that I need to have in front of me before I begin to complete my ER template. Now, we talked about this at the beginning, where USAID set budgets by intervention for COP19 fiscal year 20 last year. We set those budgets. It's possible not all of you actually received a budget by intervention that looks like what you're seeing in this green and gray box down at the lower left-hand corner. You of course had a budget, but it might have looked like a budget like this is what you're allowed to spend by personnel, by travel, by supplies, etc. That you probably were given that budget at the very least. But just in case you did not receive your budget by intervention, which again is that green and gray box at the bottom, USAID has basically extracted all of those budgets from our FAST budget tool, and we have made those available to all of the ACORs. And so I would encourage, as you're getting ready to complete your ER template, that you ask your ACOR for your budget by intervention. It will look like that green and gray box there at the bottom. And then you have your COP19 fiscal year 20 ER template, which is the graphic in the back. And then you also just keep handy that classification reference guide downloaded from datum.zendesk.com. All of the answers about definitions will be found in that document. It's very easy to search and find things in that document. So now that we've got our budget by intervention, our clean template, we're going to go through what the actual template looks like. The first tab that we're going to go through is called the metadata and error checks tab. And essentially at the top, you will see this is the information about the award that you manage. So you'll need to put in what the federal agency is going to be, USAID. You'll need to enter in the name, your DUNS number, your organization's name, your award number, things like that. If you do not know some of this information, like your MEC ID, your mechanism ID, or you do not know your basically your USAID ACOR can give that to you. Same with your award number. If you do not know that, please reach out to your ACOR and they can help you. Your DUNS number is something that is unique to your organization. So someone within your organization, probably on the finance side or whoever was responsible for business development, should be able to give that to you as well. But you will need to complete all of those sections at the top that just identifies your organization and the mechanism that you manage. I also want to point out, we see this every year where partners are using expired templates. The template that you need to complete, you will see in row 7, the reporting period says fiscal year 20. And you'll see in row 6, I've highlighted the data set says expenditure. Every year we have someone, and it's typically those that have done ER for a couple of years, but it's folks will just take their ER template from last year and they'll just update it. Or they might take their COP20 budget template and they'll just update it. And you can see, as I've highlighted, reporting period and data set, if you're trying to use an old or expired template, the system will not accept it. You need to be sure that you go to datum.zendesk.com, you download a clean copy of the template, and I would recommend everyone make a note that you check that your template says reporting period fiscal year 20 and data set says expenditure. If you complete a template that says data set budget, or you complete a template that says reporting period fiscal year 19, you will have done all that work and you will have to start over again. The system will not accept that template. So please be sure to download a clean template and check to make sure that these two markers are identified for fiscal year 20 and expenditure. Okay, so step number 1 of completing the template. So you've got your budget by intervention, that green and gray box down at the bottom. And you can see we've got four rows, and essentially we have community-based testing, we've got prevention, and we've got another care and treatment clinical services. So what you'll want to do is you'll want to reference the program area, which is that first column, and then the beneficiary, which is that second column, and you'll want to enter it into rows 4 and 5 on the template. So you can see row 2 is community-based testing service delivery, aimed at non-targeted population. And that's what I've entered into column F. They're just drop-down menus. So that will be a simple entry on that. Make sure that you use the drop-down menu. Do not copy paste this in, use the drop-down menus, but you have that as a reference. This is your COP19 fiscal year 20 budget. So go ahead and enter in those headings first of program area and beneficiary. Step 2 then is going to be you as the partner completing the template of the expenditures for each intervention by cost category. So you as the partner may know that your budget was $367,598, which we see at the bottom, for community-based testing service delivery aimed at a non-targeted population, young people and adolescents. And so you as the partner would then fill in the blanks. So of that 367,000, which was your budget, again, which is what we see in this first row here, row number 2. So you would be filling in what essentially was the cost category detail. What was the breakdown of that 367,000? Again, that budget by 367,000, that is what our estimate was. Please ensure that you are reporting what was actually and accurately spent. If you spent more or less on that, just go ahead and enter in what was actually spent. But at the very least, you know what the reference point is. If you have any questions or any concerns about these deviations from what your COP19 budget was, go ahead and just complete the template as you feel is reflective of your program, and then talk to your ACOR about it. So that's on completing the cost category section. Now, in the example of I'm a prime partner and I have one subrecipient that I need to collect information for, what you'll do is in row 30 of the expenditure template, you will enter in the number of subrecipients. And so in this case, I've entered in 1. And then when you enter in one, the rows 33 and 34 will pop up for just one row, and you will essentially need to enter in the same information on that subrecipient, the subrecipient's name, the subrecipient's DUNS number. And again, you should work with that subrecipient. They should know what their DUNS number is. If they don't, they need to talk to someone in their organization to find it. And then you need to then ask the subrecipient, what expenditures do they have for each of the different interventions? It's possible that every subrecipient may not have expenditures in each of the interventions. In this case, this one subrecipient only does work in care and treatment, HIV clinical services in that last column. The subrecipient doesn't do any prevention and they don't do any community-based testing. So they would only report the expenditures in the intervention in which they work. You will also note that the subrecipient reported expenditures are a combination. So we don't need to know this year the detail of what of that 177,000 that we see that the subrecipient reported. We don't need to know the breakdown by personnel, by travel, by supplies, etc. We just need that top line number. But again, that's a number that you as the prime is responsible for collecting from the subrecipient. The last thing that I will say about this regarding subrecipients is a little note to what I just said. This year, you only need to report the aggregated total of what the subrecipient spent. However, we do expect next year that all subrecipients will need to complete this ER template. That is not something you have to worry about this year. You do not have to report all that cost category detail for your subrecipients, but we do think that that is what is going to happen next year. So this year, it's a combination of all the cost categories for subrecipients, but next year, it's possible, it's probable that subrecipients will have to complete this template. Don't worry about this year other than just kind of working with your subrecipients to ensure that they're familiar with ER and that they know that as the fiscal year goes on, as this implementation year goes on, that this may be a requirement for them as well. But for this year, it's only a combination. It's only all the cost categories combined. Okay, so after we've entered in our subrecipient information, we'll then be able to essentially look at the rows that have been auto-calculated at the bottom. So you can see at the very bottom, we are looking at our expenditures entered into the ER template, and we can compare that to the budget by intervention in that green and gray box. So I've mentioned this a few times before. It's possible that budgets may not match expenditures or expenditures may not match budgets, but just have that discussion with your ACOR, especially this year with COVID. We are very confident that there are going to be a lot of misalignments, but we just want to understand what is really driving those misalignments. So do not feel as if you have to put in an exact match, put in what was actually spent. And that's it. That's essentially what all that you need to do as an implementing partner. So in some ways, it's very different from last year where a lot of you maybe had to define those interventions yourself and those budgets, those expenditures yourself. This year and moving forward, USAID has done a lot of that work for you. So you at least kind of know that ballpark and you sort of know what the expectations are. And so it's essentially then just completing the cost category detail. Some of the changes, we've already talked about this, but I just wanted to show you in the template as well. You can see that there are revised cost categories for that clinical and ancillary under personnel and contractual. The template has added a IM closeout costs subprogram area in the menu. So you might now see 2 columns of program management. And if you only have closeout costs, I would expect that first column of program management to be blank. And if you only have closeout costs, put all of your closeout costs in that drop-down menu for a closeout cost there. Again, if you have any questions on your budget by intervention, or you have any questions on ER, please be sure to reach out to your ACOR in advance of that first November 7th deadline, which is when we really want to give time for ACORs to do that review, so that if they have any concerns, they can communicate that to you and you can meet that final data collection deadline of November 13th. Have that conversation with your ACOR now. If you do not have your budget by intervention for COP19, ask them for it now. They are probably in the process of getting that to you if you've not received it, but have this discussion about expectations with your expenditure reporting with enough time so that you can ensure that you are submitting a template that's accurate. We essentially are saying that if you want to add program areas or if you want to further disaggregate, we understand that if you're giving us more detail and more data, I think that's perfectly fine. Again, just have that discussion with your ACOR so they sort of know what to expect. You know, essentially, as we set these COP19 budgets and we look at the expenditures, I think we just want to be sure that the ACOR is aware of why those misalignments happened, which is why we ask you to report accurately, but also have that discussion with your ACOR. A couple of common errors that we tend to see in the template, I just wanted to flag a few of them for you. One is where there's no program management entered in at all. If you only have closeout costs, we do expect that you would select that PM IM closeout program area and enter in that in that column. So you may be able to leave the first column blank, but you still need to have some kind of program management entered in for closeout costs. So it's impossible for a mechanism to not have any program management. So that will be an error flag in the template if you do not enter in IM program management or IM program management closeout costs. We have other things called sort of impossible combinations. So that's when a combination of a program area and beneficiary doesn't make sense, such as this example where I have voluntary male medical circumcision aimed at adult women. That probably doesn't make a lot of sense. And so that budget probably didn't happen. It might just be an error when you're selecting categories from the drop-down menu. You might have selected the wrong category. The template will turn red when those impossible combinations happen. So you will know when there's an error. If you see red, you need to correct it. And same thing in that column G, where it's possible you might have accidentally forgotten to select the program area, in which case the template will flag that for you, and you need to go into the cell and then select that program area from the drop-down menu. Other things that are error checks are if you do not complete that upper portion of this template. So if you don't have your mechanism name, your MEC ID, you don't have your award number, if you don't have any dollars in the columns, these are all going to be checks that you will see in the template. So be sure after you've completed the template, go back to the metadata and error checks tab to see if anything here is red. If you're seeing red, it will which is what we're looking at right now. It will very clearly show you where there are errors that you need to clear. When you have completed this template, you will ultimately need to upload and submit it into the online system Datum. And Datum will not accept any templates that have these red error flags. So do not think that you can submit a template that has these errors. The system will just simply not accept it, and you'll need to resolve this before it's successfully submitted. Okay, I'm going to talk about Datum and just a couple more resources as my final slides, but I'm happy to take questions at this point.
Thank you. Since the accounting system was not set up based on intervention area for COP19 for new awards, how does one do expenditure reporting by intervention areas?
That is the million-dollar question, no pun intended, on your last day of the fiscal year humor for you. That is a very big question, and the answer is essentially that every organization is different. You know, we have something like 900 awards at USAID. And so we do not want to be prescriptive. We cannot be prescriptive to implementing partners on what you as an organization need to do in order to meet this reporting requirement. So you need to know that it's a requirement, but it's sort of up to you on the creative ways in which you are you are sort of modifying the way that you work in order to kind of work in a different structure like this, right? There are some organizations that they have incorporated PEPFAR program areas into their timesheets so that they know exactly how much time is being spent on personnel for the different program areas. There are some organizations that do sort of a mini ER on a monthly basis. And so as they do their monthly reconciliations and they submit their invoices to USAID, they're also sort of then putting that into a framework and a structure for ER. And they're doing that on a monthly basis. It's a good question. I don't have specific examples for you. I think that, maybe reaching out to other organizations to see how they do it is a really great, and I think honestly, it's a great question and be something that would be really good to share, and something that this year we can collect information on and maybe share with new partners for next year. But the short answer is really, it's up to you as an organization as to how you choose to make that happen in your organization. The only thing that I will say is, I do not recommend doing ER on an annual basis, meaning I think it's, if you can find a way to sort of reconcile your accounting system according to an ER framework, that will make your life easier when you sort of do these reconciliations on a month by month basis. If you sort of end the fiscal year and you look back and say, okay, we spent $2 million, how are we going to untangle all of this and put this in the different buckets? It will take you some time. If you're doing this for the first time, I mean, don't stress, don't sweat. I mean, there's plenty of folks that are willing to help you and work with you. Do your best. We ultimately just want to understand what happened. As long as your reporting reflects what do you think happened in the last fiscal year, spending wise, you're telling us a story in that way. And so do your best. But try to get ahead of it, try to make it a routine thing, and that will make it easier for you moving forward. And you'll learn lessons learned on what works for you and what doesn't work for you. Sorry, I don't have anything more concrete than that, but it's just because every organization chooses to do it differently.
Thank you. What is the correct way of saving the ER template once completed so that it's acceptable for upload into dating?
I'm not quite sure how to answer that. I mean, I think, if you go back to the error checks tab, I mean, essentially this just needs to be clear of any red flags. You don't want to see any red flags here. You don't want to see any red flags here. Once essentially the template looks clean, theoretically, you should be able to upload and submit into Datum successfully. That shouldn't be a problem. But as I mentioned, we see this every year where there are, again, copy paste errors. For some partners have somehow been able to unlock templates. I don't know how, it doesn't really matter, but don't unlock a template because Datum will also know that you've unlocked a template. So just try to keep it as a clean template as much as possible. Do actual entering of data. Don't copy paste. I cannot guarantee, I mean, we've been told by OGAC, don't copy paste. I can't guarantee if you copy paste that it's actually going to be successfully uploaded and submitted. So I think as long as you are just, working off of a clean template and you're manually entering everything in, that is the best way to ensure that you're going to have a successful upload and submission. Some partners like to do a lot of the work out in separate sheets. And that's completely fine if you need to do your reconciliation on other Excel files, but just again, don't copy paste, just translate whatever that final product is going to be and manually type everything in and you should be fine.
Thank you. Is it advisable to have a long list of interventions instead of combining them and keep only those which reach a certain percentage? And if yes, what is that percentage?
Right, that's a great question. And it again is a little bit of a change from how we've been doing expenditure reporting the last couple of years. If you are a partner that has completed ER last year, you may feel as if you were in the driver's seat for defining the interventions for your mechanism. And you may have said, we want to say that the $5 million that we spent last year, was on these 9 interventions. You made that choice, and you might have done that in collaboration with your USAID ACOR, but it was something that the partners looked back on, reflected, and completed. But as I've mentioned, starting this year and moving forward, essentially these interventions will be defined for you. You no longer need to worry about what interventions do we need to enter into the template, because you will be given your budget by intervention, right? You can see that in that green and gray box right there. That's the example that we've been using. You may not have received your COP19 fiscal year 20 budget by intervention yet, but I am fairly confident almost everyone has received, everyone should have received their COP20 budget by intervention. And so that is essentially your foundation of working off of. And so if you need to deviate from that, again, that's fine. I think we just want to understand what and why. But that's a discussion with your ACOR. But so you're no longer needing to worry about how many interventions you're going to put in your template, because you will be told how many interventions that you want to put in. Again, if you want to further disaggregate, I think that's fine, but I would just talk to your ACOR about it. Like if you have a lot of care and treatment and it's all non-targeted population, and let's say you want to disaggregate those populations into care and treatment for adult men, care and treatment for PMTCT, and care and treatment for another population group. I mean, as long as it's sort of in the ballpark of what the budget was, I think that's fine. But it's just something that you might want to, you're not asked to do it. It's just if you want to. I think the interventions, you can now go up to like 35 interventions. If you are a finance person on this call, that's probably a little scary to think about splitting a budget up this way 35 different times when you think about whatever your total budget is for the year. Then you're starting to kind of look at like line items that are like $12,000 or $7,000 or $30,000, and depending on how large the award is, it can get really, really spread out. And yeah, we might know more information about all the populations and all the subprogram areas, but we're essentially trying to work off of a very good best guess.
Those are the questions for this segment.
Okay, great. Okay, just a final couple of questions or final couple of slides here. And that's essentially the submission and datum. We're not going to go through a datum demo or anything like that, because again, I don't think it's live yet. It will be open and live tomorrow. But essentially, we recommend that at least 1 or 2 people from each of your organizations has a registered ER budget datum account. And those will be the designated folks that will need to nominate someone in your organization that will be responsible for template submission. Whoever it is that you want to be, if it's a finance person, if it's a strategic information person, if it's whomever it is that you want to have do it. But I'd recommend at least 1 or 2 people so that, or an institutional account or something like that, so that you don't just have one person that has an account in case that person leaves the organization, or if there's connection issues, just try to have a couple of different accounts. There's no limit on the number of accounts you can have at the partner level. Just kind of, if you're a partner on this webinar that has worked on the COP20, that submitted a COP20 fiscal year 21 work plan budget template, if you are familiar with that and you have, excuse me, you had a datum account, the accounts will essentially expire within 95 days. Sorry. They'll expire within 95 days. And so if you do not log into your account right now, your account will be deactivated. And it's not too difficult to reactivate your account, but it's just easier if you can keep it active. So I logged into all of my datum accounts. I have a couple different country accounts. And so I made sure to log in so that my accounts do not expire. So if you completed the COP20 fiscal year 21 work plan budget process and you have an account, just really quickly today or tomorrow, try to log in. All you have to do is log in and your account will be good to go for another 95 days. That 95 days restarts. So try to do that. That just kind of makes life easier for you. If you didn't submit a work plan template, or if you, you'll need to go to this link below on how to register a Datum account, or you can just request a new Datum account if you did not work in the work plan budget process for COP20 fiscal year 21. So, you know, essentially there is help available for you to get your accounts, whether it's just logging in to keep it active, whether it's registering a new account or getting your account reactivated if it expired. It's no problem, but it may take a day or so for someone to get that all set up for you. And so just be sure that you go to the documentation that I've referenced on the Datum Zendesk, which is complete and total clear instructions on how to get your account reactivated or to get a new account, and who to contact and all of that. So your submission will be on datum.org. And so this is where you will need to both upload and submit your template. This is a two-step process. And so it's a little bit of a bug, not a bug, it's a little bit of a quirky thing in the system, is that you can't just upload your template and click submit in one place. You have to do it twice. And that's essentially because there are validation checks that happen in the system. And so when you upload your template, the validation checks are running. Once your template has been considered valid, you need to then go into a data approval app and you need to click submit. If you do not fully submit your template, if you only do step 1, upload, and you don't do step 2, submit, your template will not count. So this is just something that you want to be sure that you're not only uploading, but you're also submitting. It's a two-step process. Those of you familiar with this last year or with the work plan process, you may remember that you did your upload in what was called the data entry app of datum.org. The data entry app is no longer where you will submit your template. Or where you upload your template. You will upload it in this new app called ERB Processor. So I recommend you make a note of this, because it will confuse some people, because the data entry app still exists. It's just for the indicator data. So you cannot go to the data entry app in Datum and upload your template in data entry. You need to go to the ERB app in Datum. You will still need to submit your template in the data approval app, and USAID will still approve your template in the data approval app. It's just where you upload it will be in a different place. Again, we're not going to go through a demo of this because there are fantastic resources available to you on Datum Zendesk that will help you step by step by step. Where do I go? Where do I find it? How do I log in? What do I do if there's an error? Very, very comprehensive. And so please go to Datum Zendesk and download those materials. Just a couple of last helpful tips and tricks for everyone. We talked about this when we went through the template, but please be sure to download a current version of the template. Again, if you use an old template or if you somehow unlocked the template, you will be asked to start over. So the entry is really not that bad. I think the work is really on the ensuring that you have put your expenditures in the right interventions and you know what the cost categories are going to be. But when it comes to actually completing the template is not, it's not terribly long to complete it. It'll take a little bit of time, but it's not long. So just go ahead and work off of a clean copy. I mentioned don't overwrite the file, don't unlock the file, and do not copy paste. Again, if you want to try and copy paste, that's your choice, but I cannot guarantee that it will work. We've been told to advise people to not copy paste as values. I just suggest that you don't do it. I mentioned that there's validation checks that are built into the system. And those are some of the things that we've already gone over, such as missing information on the metadata tab. So you entered everything in with your expenditures by intervention, but you didn't enter in any of the mechanism information. Those will be the red flags that you'll see. Things like entering in negative numbers or non-negative numbers. Sometimes you might be typing and you accidentally bump something and you've got letters or decimal points or something in the template. The template will not accept it. Again, I don't think that this is in the guidance, but I don't think the template will accept decimal points. And we really only see that, again, when people copy paste. So if you try to enter in decimals, it will not accept it. Just go ahead and round up to whatever the nearest dollar is, and make sure that there's no decimals in your template. Again, the Datum Zendesk technical support is very helpful, as well as your technical assistance consultants. So again, you will be put in touch with those consultants, and their job is 100% to help you digest the guidance, enter everything into the template. You can email your template to your consultant and ask the consultant to do a review for you, and they'll say everything looks good, you completed everything fine, and then you can go ahead and talk to your ACOR about, can I submit my template? Are you satisfied with it? Don't hesitate to reach out to the consultants, because they are there available to you at no cost to help you with this process. And so please, if you want to email them or call them every single day, that is why we have made them available to you. So don't hesitate to work with them. And then the last thing here, I've been talking about Datum Zendesk, and I just wanted to show you where to go for all of the information. So when it comes to datum.org submissions, so we talked about uploading into Datum Entry and upload and submitting. Where do I go to find resources? You go to datum.zendesk.com. And then the Datum Trading and Tutorials page is where you'll find the instructions for IP users. There'll be instructions for USAID field users to approve or reject your template. There are files on the common errors beyond what we talked about already. There is a file that will help you clear those errors. If you're not understanding what some of the status levels are, if it's pending at partner, or if it's approved by partner, or if it's submitted to agency, what does all of that mean? You can find that out in the Datum tutorials and training section in Datum. And then this is where you can also request a Datum user account as well. The next session is on, we're still on Datum Zendesk, and this is where you're trying to find guidance. So let's say you want to understand, where do I put rent? Under where does rent get allocated to? What cost category? What is the inclusion criteria for, what is the difference between a contracted worker versus a full-time personnel staff? Where do I put the money for those two types of people? So you would find answers to all of that in the PEPFAR Financial Classification Reference Guide, which again is found under the PEPFAR guidance section. This is where you will also download the template. And this is where you'll also find a handout that's called What's New for Reporting for this year. And then last, this is probably the most important part, I would say, when it comes to submitting your template, is knowing where to go for technical issues. A lot of times, if you're getting an error on upload and you do not know how to clear the error, and you've already read through the guidance and you don't understand, you've talked to your consultant and the consultant doesn't understand, you can go ahead and submit a help desk request. And this is where you'll go to Datum Zendesk under technical support and click submit a request. And so some of the common errors that would be useful for you to use the help desk would be, there's an invalid template and you just don't, like I said, you don't understand how to clear it. Let's say you go to Datum and you cannot find your mechanism and the list of mechanisms. I don't think that should happen, but just in case you don't see it there and it needs to be added, you would need to go to technical support and submit a request. Let's just say for some reason your account does not have the privileges to upload or submit. Like every now and then, like one person globally just doesn't, they can't see the upload or submit button, or they can't see the reject or recall button. You would need to submit a technical help desk ticket for that. If you forgot your username or your password, or any other just kind of weird technical glitches in the system, please contact the help desk. You know, I cannot help you. I do not know the answer to any of these issues that we just went through. Likely your USAID point of contact is not going to know either, or your AOR. You know, certainly, you know, exhaust all the resources that are available to you. But if you still just are, I don't know why the system won't accept my template, go ahead and submit a help desk ticket. They're I think based in South Africa, so you won't have as much of a time difference for most of you, and they're very responsive. And then, the other thing I'll say is, this is again why you do not want to wait until the last day. If you go into datum and your mechanism is missing and you don't realize that until the day of submission, you will not make it. You will miss the window because it may take a day or two for the request to go through all the channels to add your mechanism in datum. Again, that's probably unlikely to happen, but it's just an example of you are one person in a queue for the help desk. And in order for them to work with you, you need to give them time to work with you. And I just really encourage you to try to aim to upload and submit 1 or 2 days in advance of the deadline. That's essentially all that I have for slides. And so I am happy to take any questions about anything that I've talked about with process or background, or anything that we've talked about today.
Thank you. Is there any link between expenditure reporting and M&E data? Or is there any way of triangulating expenditure reporting data with M&E data to ensure consistency between the two data sets?
So that's a great question. And for the purposes of reporting, we are not asking you to report your expenditure data alongside your M&E data or your MER indicator data. We're not asking to do that. However, you are doing that just in sort of parallel processes. Expenditure reporting is not the only thing that is happening in datum at this time. If you as a partner have targets, you're entering in your results in datum as well. And so we are seeing basically an annual snapshot, but it's just happening in different parallel processes. I would say, as USAID and just sort of PEPFAR more broadly, we do look at them side by side. We do triangulate. And I mentioned earlier, it's one piece of information when we're trying to understand what's going on and what challenges we're experiencing, what we need to do to remove barriers, what some of the successes are that we might be able to scale up. We do that through data triangulation, which again is happening at the USG level, but certainly does not mean that you as an organization cannot also do that internally. And I know a lot of implementing partners do that. You're not waiting around for USAID to tell you what your data looks like, that you're as an organization, you are doing that on your own. It's your data, you're reporting it, you're doing the work, you're doing the spending. And so I encourage you as organizations to think, in the long term, what is it that you can do to incorporate some basic analytics based on the reporting that you're doing for PEPFAR? Internally, what can you also be doing? This is a collaboration between USAID and implementing partners. It's a very open conversation. And so I think that we just want to ensure that we're all on the same page regarding, again, what are the challenges? What are the successes? What are some of the things that we need to do to kind of move forward? And essentially, when we aggregate the work of all the implementing partners in a country, get a step closer to epidemic control.
Thank you. After you click the icon ERB processor, what comes next?
That is a great question. Again, it is not live yet. It will be live tomorrow. So I myself have not been able to see what it looks like. But if you go to the guidance that I referenced, there is step-by-step instructions. You can download this PDF called Instructions for IP Users, and it will show you exactly what happens next. Again, I haven't been in the system, so I don't really know. But I have scanned the PDF documents to see that it will walk you through what you need to click on in order to get your template uploaded. So go ahead and download that PDF, Instructions for IP Users, and everything you need will be contained there.
Thank you. If a sub has spent funds on the activity before September 30th, 2020, but as a prime, we don't pay them until October, do we include this sub payment in this expenditure report?
No. So if that payment to the sub has not hit your bank account or will not hit your bank account until next month, do not include it. That's a good question. we only want to know basically what you have paid, what you as the prime have paid out. And we understand that there's accrued expenditures and accrued expenses and all these kinds of exceptions, but for the purposes of ER reporting, only report on what actually left your bank account by September 30.
Thank you. If the system is cash basis, how would one report VAT in the annual expenditure report?
So you again would report on, that's a good question actually. I think you probably are reporting, if you're not paying the VAT out until the next month or two, then you're basically reporting VAT that's like a year behind. But again, it's part of the cash basis accounting caveat is that we know that there's going to be some portion of expenditures that are attributed to the previous fiscal year but aren't paid out until the next fiscal year. And so it's generally speaking, it's around like 5 or 10%, and we see that same 5 or 10% each year. And that's just again a limitation of, or not a limitation, but it's a caveat. We had to pay cash or accrual basis of accounting. The choice was made to do cash. And so again, if you're paying that VAT out for the previous year's implementation, but you're paying it out in October or November, it's going to be in your next year's ER, but then your previous year's ER will be included in that current year's reporting, if that makes sense. So if you're starting out in the first year, then yeah, I mean, you're going to essentially be missing that VAT. But the subsequent years, every year after that, it's going to still be, you're still going to have VAT reported. It's just going to be VAT from the previous year's implementation year.
Thank you. What line item would one report subrecipient expenditure, including personnel costs?
Right, so again, when we go back to the template, you will report all subrecipients as one category. So you can see in this example, I'm saying that this mechanism only has one subrecipient and they are reporting 177,936. That's that lower right-hand corner cell under intervention 4. You can see that's essentially the total spend by the subrecipient. It is a combination of all cost categories. So of that 177,000, I do not know what was spent on salaries. I do not know what was spent on travel. I do not know what was spent on training. All I know is that subrecipient in the last fiscal year for care and treatment HIV clinical services spent $177,000. So it's just one number. We don't know what that number is going to, we don't know what the detail is, but we can at the very least know the proportion of a total spend for a mechanism that is done by the subrecipient.
Thank you. How can a new user register for a dating account?
Again, if you go to the reference documentation for Datum tutorials, it will show you, it will give you instructions on how to register for a Datum account.
Thank you. Are the instructions available in other languages like Portuguese, French?
Yeah, that's a great question. Unfortunately, USAID does not manage expenditure reporting, nor do we manage the resources. This is a process defined and managed, and all the resources are generated by OGAC. And they have not made these resources available in other languages, unfortunately. At USAID, we do not control that, unfortunately, nor do we have the resources to do translations. It's something that we can certainly raise with OGAC, that we think it would be valuable if they could translate at least some of the guidance materials, like the instructions for IP users, into multiple languages. We can certainly make that request of them. I'll see if it can be done this year. I would probably guess no, but hopefully for next year's reporting, I hope that's something positive that we can make available as additional resources. But I would say, so you do have a technical assistance consultant, and you know, the French-speaking countries have French-speaking consultants. So if you do have a difficulties in these very kind of long, not difficulties, but I mean, if it's easier for you to sort of talk it out with your consultant, they can help with some of that as well. With you know, this language is it's a lot of jargon. Expenditure reporting, you've got cost categories, and you've got, you know, service delivery, non-service delivery, site above site. I mean, a lot of it is, it's a lot to process. And so definitely reach out to your consultant. And I think this year would be the best resource for helping with any translations. But yeah, well, I'll make that request of OGAC for next year.
All right, we'll take our last question. What will be the effect of unpaid and accrued expenditure on next year expenditure or budget ceiling?
So yeah, I'm not an accountant, or I don't work in finance, but I mean, I think this is essentially similar to the what do we do when you know, we accrued our expenditures September 30, which, you know, a lot of folks do. It's the end of the fiscal year. You accrue a lot of expenditures on the last day of the fiscal year, but they don't get paid out until the next fiscal year. So again, when you're in the first year of your mechanism or first year of implementation, it's essentially going to look like you probably are not spending everything that you want to attribute to that implementation year. Let's say you spent $1 million on activities, and then in the last 2 weeks of September, you accrued, like, you know, $50,000 in equipment and, you know, other things. That $50,000 is not going to get paid out until October. So it's essentially going to look, you're only going to report that million, and that 50,000 will then move into the next year's reporting. As you go into years 2 and year 3 and year 4 of your project, it's going to all balance out, because let's say that 50,000 that you paid out for the next fiscal year, and you report it for fiscal year 21, it's going to be the same thing in the next fiscal year. You'll have another 2 weeks at the end of fiscal year 21 where you may have had a lot of expenditures that you accrued but didn't pay out till October, so they'll be reported in the next year. So it's just sort of this understanding that there's going to be a bundle of expenditures every year that, you know, relate to the previous year's implementation year, but then don't get paid out until the next year. But they should be relatively the same. I mean, you're probably buying a lot of investments in your startup year, and so that might be a big chunk of money that would hit your year 2 when it's really attributed to year 1. But then it kind of balances and smooths out in year 3 and year 4, that you may only have, you know, a certain amount of money that's regularly paid out in the next month. I hope that answers your question, but we understand that there's going to be, because of cash accounting, the cash method of accounting, there's going to be some transfer of funds where, you know, when you report your fiscal year 21 funds, there's going to be fiscal year 20 attributed funds included, but we understand that. It's just the cash versus accrual.
Thank you. For the rest of the questions, we will answer them and share them with the webinar materials, both the recording and the PowerPoint material. We'll also include questions and answers to all questions that have been asked during the webinar. Thank you, Erin.
Thank you.
So thank you, Erin, for that great webinar. Thank you, everyone, for making time for a webinar. That ends our session today. We appreciate you making time for us and participating in this webinar. Thank you very much to everyone who made it in. Thank you, and have a great rest of the day.
Hey, Mary, I'm just looking through the questions right now. So sorry if I'm keeping you on the line. I just kind of wanted to scan through, you know, what we got through, what we didn't get through, and where there may have been things that weren't clear. So I'm just doing a quick scan here.